Now we can focus mostly on clinical, clinical presentation of the malignant skin tumors. Tumors mostly, as the name implies, can be manifested or can be found as a lump or a nodule over the skin, or sometimes as an ulceration or a wound that is not healing easily. However, especially when we are dealing with malignant melanoma, sometimes it's very difficult to recognize the lesion in early stages. In that situation, we recommend to consider any changes that happens in any lesion, any mole, any unusual changes can be considered as suspicious for malignancy. Diagnosis of skin malignancy is mostly clinical. Clinical suspicion is important. Actually, a high index of suspicion is necessary to think about malignant skin tumor, especially if we are going to diagnose the disease in very early stage. It needs very high index of suspicion. But we have some tools for the diagnosis, including dermatoscopy, and then finally we can do the skin biopsy. I have a dermatoscope, a very simple type of dermatoscope that I will show you. It's very simple. It's actually magnifying tool, and then we can imagine there is a suspicious skin lesion. We can just simply put the dermatoscope over the surface of the skin, and then we can even estimate the diameter of the lesion. This is a very simple type of dermatoscope. However, there are new versions of dermatoscopes that are digital type of devices, and it can be connected to the laptop or even to the phone, and we can record the photos, and then we can compare later with other photos that we obtain during our observation. Generally speaking, for the best tool for the diagnosis of the skin malignancy is still skin biopsy and histopathologic examination. If we are dealing with non-melanoma skin cancer, roughly we can do incisional biopsy. Incisional biopsy means that you can take a part of the lesion, and then you can send the sample or the specimen to the pathologist, and then you wait for the report of the pathologist. On the other hand, for malignant melanoma, or when you are dealing with malignant melanoma or any pigmented lesions that are suspicious for melanoma, the best type of skin biopsy is, or preferred type of skin biopsy is excisional biopsy. Excisional biopsy means if we can, it's better to completely remove the total skin and the total involved skin, and then to send it for histopathological examination. But if it's not possible, still we can do the incisional biopsy, and after getting the result, we quickly remove the remaining tissue. Um, when uh, when we diagnose the malignant tumor of the skin, then we have to think about the treatment. There are many treatment options for the skin malignancy. Roughly, we can do the excision and to remove the whole lesions. Most of the time, it's practical to remove the lesion when we are dealing with non-melanoma skin cancer. But for malignant melanoma, sometimes it's difficult or needs some additional treatment modalities. There is one particular type of surgical procedure for skin malignancies, especially for those ones that are very big. We call it Mohs surgery. In Mohs surgery, the purpose of the surgery is to preserve the tissue as much as possible. In that surgery, during the surgery, they send several samples to be studied at the same time and to decide whether we reach the tumor-free margin of the lesions or we have to continue excision. So if the pathologists tell us that the lesion, the tissue is no more involved with the tumor, then we can stop the excision and then we close the wound. There are some non-surgical options also. Mostly is appropriate for the superficial type of skin malignancies, which is cryotherapy, electrocautery, and even some immunomodulatory agents that can be applied as a cream, topical creams, namely 5-fluorouracil and imiquimod. On the other hand, when we have advanced type of skin malignancy, we have to think about systemic immunotherapy. So there are many different names, many different medications with different names available for immunotherapy. Collectively, they are called checkpoint inhibitors. Now, I'm not going through the details of this type of medications, and I will briefly focus on the preventive measures that we can use for skin prevention of skin malignancy, especially for those people that have family history of malignant skin tumors. The most important and the most fundamental step is to protect from sun. Roughly, when we have chronic sun exposure, it will predispose patient to the non-melanoma skin cancer. But if we have sudden attacks of sunburn, several attacks of sunburn or sudden exposure to the sun associated with sunburn, it will be mostly important for development of malignant melanoma. Then we have skin examination, especially for those people that have many moles over the skin. Even we can arrange for mole mapping, that is with using a digital dermatoscope. we can observe and do surveillance for the patient, and also we can think about elimination of other risk factors which I spoke about: radiation, chronic wound, exposure to arsenic and tar. And recently I saw a study that recommended nicotinamide, which is vitamin B3, for prevention of squamous cell carcinoma. Thank you very much for your attention. I think we can have another session for discussion about basal cell carcinoma later. I hope this lecture will help you to understand pathogenesis, clinical features, and treatment of skin malignancies.
Thank you so much. Thank you.